The following program is a Town of Colonie television production of the William K. Sanford Town Library.
Hi, I'm Mary Rozak, Director of Communications for Albany County, and this is Albany County News. In the next 28 minutes or so, I hope you'll find it very interesting, learning about one of the departments in Albany County, what in fact you can benefit from, and how we in fact are benefiting the community by offering the services through today's discussion. The Department of Mental Health is what we're talking about today, and joining me is the Director of the Albany County Department of Mental Health, Dr. Steve Giordano.
Hi, Mary.
Welcome.
Thank you very much.
What I want to talk about is we are actually fresh in the middle and at the end of the holiday season. People are stressed out. You don't look very stressed out. You look very, very comfortable. But there are a lot of people that are stressed out during the holidays, post-holidays. Those bills start coming in. What advice can you give people about the whole stress factor, fighting that, and once it's too late and you're already stressed out?
Yeah. Well, it is kind of ironic, isn't it, that at the most joyous point in the year, so many people feel so stressed.
Sure.
And I think it's a conversation that I have very often with people. So I think people put unrealistic expectations on themselves in a lot of regards. It's okay to be stressed, I guess, is the first thing I have to say. There's complicated family involvements. I remember talking to someone recently who said they're an adult, they go home and visit their parents, and all of a sudden they feel and are acting just like they used to when they were younger. There's certain natural things that happen during the holidays. But if your relationship with your family has been stressful, it's going to be stressful around the holidays. There's the whole financial piece that you talked about. And of course, folks have emotional struggles over the course of the year that sometimes get more exaggerated during the holiday season.
Sure, we think it's the happiest time, and yet we know that oftentimes it can be sad for people who are alone, people who've lost a loved one.
Well, that's exactly right. Anniversaries is one of the most stressful times for people. You remember those who aren't with you when those holidays come around. I always say to people that you shouldn't compare your insides to other people's outside. And we look around, everyone's trying to be happy.
Sure.
And many of us are at times. I think, by the way, being happy all the time is an unrealistic expectation for the best of us. So I think that being gentle with yourselves, acknowledging what you're really going through, and sharing it with others is really important. You can't force happiness. Happiness doesn't run on a calendar. And I think the desire to be the perfect host and to get gifts for everyone and to have great relationships with all those family members who you might not really have great relationships with. It's very understandable that would be a stressful time. So I try to recommend to people, plan ahead, try to avoid getting stressed out to begin with. Set a budget, try to keep with it. Don't let go of your healthy eating habits just because it's the holidays. Because
I know, but that's so easy.
It's easy to say, but I think we have to understand that overindulgence leads to feelings of guilt and stress. So there's things we do to add the stress.
Or maybe, as my husband reminded me today when I said I've eaten a little bit too much already during the holiday season, he said, Friday night is the most wonderful night at the gym. No one else is there, and it would be, maybe getting back and doing some exercise, and that actually helps relieve stress.
I think that taking a moment for yourself in the midst of all this is so critical. I talk to a lot of people who feel that they have to be the perfect host and have to give gifts to everyone and have to take care of everyone, and the last person on their list is themselves. That also is a cliche, but it's so important to remember. Exercise is a great example of taking time for yourself. reading a book, listening to music, meditation, learning meditation, and learning how to just slow down. These are things that any of us can learn and benefit from, and in my line of work, I see people who are stressed out all year long. So sometimes the holidays, just make things worse for some people. And I will tell you, again, in the business that I'm in, if people are predisposed towards stress, anxiety, and depression, sometimes the holidays will exacerbate it. And to know what your triggers are and to be aware of that this is going to be a stressful time and to make preparations is important. We treat people who are in recovery from drug and alcohol addiction. It's hard to go through the holidays if you're in recovery, for example.
Sure.
And as hosts, we need to make sure that we're sensitive to the needs of the folks that we're trying to host. Having non-alcoholic beverages at our parties makes it comfortable for folks who might otherwise be finding the holidays to be challenging. So the worst thing you could say to someone, I think, is, oh, you shouldn't feel that way, because a caring, supportive family or a friend would understand and would want you to tell them how you feel.
Sure. Well, I can tell you what one of my triggers is when on the TV, there's a commercial right now, and I'm sure if I were to belt it out, you would all say, please don't sing. But it's a woman dancing around and talking about how Christmas won't happen without me.
Yeah.
And I see that commercial, and I think, that's how I feel. I've got to do. And I think a lot of people, I'm going to go out on a limb here and say, I would think a lot of women in general might feel that way. And I remind myself when I'm watching this commercial, it is a TV commercial.
Well, that's like all those commercials of, all the happy people that everyone just looks at and says, I want that drug, I want that product, I want to be happy like them. You can't buy happiness, and
Sure. So, it's one thing to talk about trying to de-stress when someone is already stressed, and or their bills are coming in, and the stress is mounting. What can they be doing, or who and how can they be reaching out to? How can the Department of Mental Health perhaps help?
Well, I think there is. There's a normalcy to being stressed in stressful times. And I think we beat ourselves up because we have expectations of perfection often, that we shouldn't have these feelings. But that's a baseline that we all experience. And I think that your point is right, that for some, at times during the year, especially during the holidays, things might get a little bit more stressful, and people who are predisposed, as I said, to anxiety or depression might have those kinds of things become exacerbated. So I think if your feelings of sadness and depression or anxiety are persistent and they don't resolve in a timely way, it is I advise people to reach out for help. And certainly, the mental health department, we're going to talk about in a few moments, I think, in more detail. We serve folks in our community who are chronically mentally ill, seriously mentally ill, oftentimes the folks that aren't easily served elsewhere in the community. But you can call us, anybody can call us, and we'll hook you up or direct you to services in the community, whether you're a little depressed or a lot depressed. And so I hope we'll have an opportunity to give out our number at the... Yeah, certainly.
Yeah. You can give it out at any point in time.
So the Department of Mental Health can be reached at 447-4555. And if the person who's calling, if their needs can't be met in our department, we field hundreds of calls a month, and we hook people up in the community. We have a great relationship with dozens of mental health and addiction programs and private practitioners. So call us, and we'll try to help you out. And
let's talk about what can be an elephant in the room when people think about mental health, and you're saying, hey, feel free to reach out, and we can refer you or give you a referral for a friend who may be experiencing some issues. But I think people think about, mental health, I'm not crazy. What is wrong, or I am crazy? The words we use, the attitudes we have, I don't know if there's anything you can suggest or talk about. Like, how do you dispel that?
Yeah.
How do you get past that?
Yeah, it's a wonderful point, and I'm actually very glad that you brought that up, Mary. We struggle with the stigma associated with mental health related issues as well as addiction issues, and the degree to which stigma is embedded in our culture influences people to not seek out help. And the language issue is a big one. I think I shared with you once a whole treatise that was developed on how to help media talk about folks with mental illness in a way that isn't increasing the stigma. The headlines, we don't see them that much locally, but I grew up in New York City, so I remember them. Lunatic on a running amok, or. These are folks, these are people, these are our family members, our friends. Mental illness strikes, 1 in 5 people in this country. There's a couple of 5 people in this room. So, everyone has a piece of this or knows someone. And I think the stigmatization that our language fosters does keep people from seeking help. They don't want to admit it to themselves, they don't want to admit it to other people, and they certainly don't want to call attention to the fact that they're feeling something that is very normal and human. Anxiety is part of the human condition. I said happiness is a nice goal. I don't know anyone who's happy all the time, and people get depressed. But what we add on to that is, I shouldn't have these feelings. If someone knew about these feelings, they would think less of me. So you hide it, and you get more isolated, and then you see all those happy people on the TV ads who you're nowhere near feeling that way. And a lot of folks don't reach out, and that's what we try to do every day in our work, is to try to destigmatize mental health-related and addiction-related issues.
And let's talk more. Just a reminder that we are talking with Dr. Steve Giordano, the director of the Albany County Department of Mental Health. Let's talk about what the Department of Mental Health does every day.
Yeah. Well, my department is I think, a safety net in our community. We have about 100 employees. We serve well over 1,000, maybe close to 1,500 people over the course of the year. Over the years, the focus of our work has changed. Without getting too much into the history of this, there has been a deinstitutionalization process that has gone on for decades that I think correctly has moved people out of psychiatric hospitals into our community, and the promise of the money following those patients never was kept. And this is a decades-old problem. So we have less and less people in the hospitals, which is probably a good thing. More and more people in our community, which is a good thing, but not enough services. And we try, the county services, many counties are going in a different direction, getting out of the business. There has been a long history in our county, and certainly County Executive McCoy has kept this promise that we've been intact for the last 5 years as a department, and we serve a very seriously ill population that can't get served anywhere else. So it's really the range of adult serious mental illnesses and addictions that we serve. But
so do people come in,
yeah,
or
so
is it a combination?
It's a combination. We have a clinic where folks who are able to get out and travel come in. We also, though, have a program. It's called Assertive Community Treatment. It's a model that was developed elsewhere in the country that brings treatment to folks wherever they may be. These are folks who are traditionally not successful in office-based treatment. So we have a team of people, psychiatry, nursing, social work, vocational substance abuse. We go out to them and we, visit them in their home if they have one. Sometimes we visit them, under the bridge, wherever they are, and we bring the service to them. But so those are the two continuums. It's all outpatient, but the larger program is where people come into us and.
But I should say you've been very humble about this. While other communities may have this, this particular assertive community treatment was the first such program to be licensed in Albany County, to be licensed in the state.
That's great, Mary. Thank you for reminding me of that, and you've obviously done your homework. Yeah, we are very proud of that. First in New York State. And it's been in operation probably the better part of 15 years. And there are, I think, 70 such programs around the state now. So we're very proud of that. We're proud of another program, too. Can I throw that in?
Sure, go right ahead.
Our mobile crisis team just celebrated our 30th anniversary.
And congratulations on that.
Thank you very much. That's another model program that other counties have copied. And
for those who aren't familiar, talk about the mobile.
Yeah, so the mobile crisis team is a team of about 7 or 8 social workers, trained mental health professionals, and from 8 in the morning to midnight, we're housed on the campus of the State Psychiatric Center in Albany, Capital District Psychiatric Center, and they respond to people in crisis in the community, and oftentimes we accompany the police who might be in a situation at a situation where someone is in crisis. Oftentimes it involves people who are thinking of hurting themselves, sometimes thinking of hurting other people, but that's only the most extreme cases. We get calls all the time from people who are just in some emotional, serious distress. We go to them. And we will try to divert people from the hospital or getting arrested if possible. And the diversion usually involves a linkage to a service in the community. As I said earlier, we collaborate with dozens of programs throughout the community. Last year, the number escapes me exactly, but it was close to 1,000 responses in the community.
Wow.
And 40 or 50% of those people did not end up getting arrested or going to the hospital. We were able to help them on scene and get them linked to a service.
And this is what we talk about, and we hear talked about all the time, that you do not want to put people who don't belong in jail or subsequently then and later on if something happens in a prison. But you want to be able to intervene and provide the appropriate service.
Yeah, that is very, very true. The truth of the matter is that our jails across the country have become our de facto mental hospitals. The word has it that Rikers in New York and Cook County in Illinois and LA County in California are the 3 largest psychiatric hospitals in the nation. Wow. They shouldn't be. And that's because the hospitals, as I said before, deinstitutionalization, they've gotten smaller. Folks get arrested on low-level nonviolent crimes that they shouldn't be in jail. It's got
to be difficult once they're actually in that situation. Right. You also, the department also facilitates and helps at the jail.
Yes,
Albany
we do.
County Jail.
We have a rather comprehensive and large satellite to our outpatient clinic in the Albany County Correctional Facility, and that's a very busy operation. No one feels good when they're in jail, to begin with.
Sure.
It's jail.
Yeah, it is jail. It is the 4-letter word.
That is right. But a mentally ill person in jail is going to do worse. And sometimes being incarcerated precipitates psychiatric distress. Sometimes, someone who is already known to be ill needs to be treated while they're in jail. So we have psychiatrists, nurse practitioners, social workers, and we're there 6 out of the 7 days and on call all the time. And that is a very busy operation.
What a challenge.
Yeah, everyone who comes in has to be screened for harm to themselves, risk. A lot of people come in, say that they're on medication, they want more of it, and we have to be careful because, as I said, no one feels good in the jail. Everyone would like a little, take the edge off. We have to communicate with providers in the community, get confirmation of records, and continue treatment when indicated. And we also have to intervene and be ready to intervene when people are in psychiatric crisis in the jail, which is unfortunately not infrequent. So yeah, that's a very big part of what we do. We are guests in Sheriff Apple's house. We work very closely with his administration, and I think we provide them a good service.
There's also another large service that you provide in tandem with partners, Catholic Charities being one of the strongest partner, and we're talking about an epidemic that people know about the opioid, the heroin use epidemic, and the need for Narcan training. I know that Albany County has been at the forefront in making sure that we have addressed that, making sure that Narcan training is available. Why don't you talk about what our program is?
Yeah. Well, as your viewers probably know by now, we are in the midst of a daunting and tragic, I think correctly termed, epidemic. And it didn't really sneak up on us. We saw it coming, and there are a lot of contributing factors to it. But the fact of the matter is, heroin is a cheap drug. It makes people feel good, at least in the beginning. The risks of heroin are not as widely known and appreciated as we'd like. We have a culture in which opiate prescription medication is prescribed to folks in chronic pain. There's a lot of medication out there. There's a lot of folks who have unused prescription bottles in their medicine cabinet, and people are abusing it. Kids are finding it, and folks are running. When they run out of their prescription, they know they can go on the street and get a drug very similar, make them feel the same way, much cheaper, which is heroin. So there's a miracle out there, and the miracle is Narcan. Narcan is the name of the drug. It's naloxone is the generic name, and it reverses opiate overdose. And I've talked to folks, first responders. Our police and sheriffs have this. Ambulances have this on their rigs. Emergency rooms have been using this for a long time. If someone is in the midst of a life-threatening heroin opiate-related overdose, administering Narcan in a timely fashion literally can bring someone back from the edge of death. So, to your question, the Department of Health and the Commissioner of Health and our Department of Mental Health and myself, along with our community partners, in this case Catholic Charities, are providing training to the community in our building once a month. The Department of Health and Mental Health share a building at 175 Green Street. It's the first Tuesday of every month in the morning that we do a Narcan training for the public. And who
in the public, let me ask you, would be the most appropriate then to come in and get that training?
Right, so that's a great question. I think everyone, to me, it's very similar to CPR training. Okay. You can come across someone in cardiac distress when you least expect it, as well as someone who might be in an opiate overdose. It sounds scary, and most people don't believe how commonly people are overdosing, but in fact you could come across it anywhere. But the folks who really need Narcan training, I think, are folks, for example, who are on long-term for chronic pain, long-term opiate prescriptions. They and their family members should be trained. It's very easy as you get older. It's pain, memory loss. Did I take the medicine this morning? Sure. I developed a tolerance already. I don't remember if I took the 3 pills this morning. I take 3 more. Mm-hmm. Before I know it, I'm in respiratory failure. Mm-hmm. A family member could bring me back immediately. That's one class of people. The other is obviously people who are heroin addicts. Catholic Charities has the Safe Point program. They do the training. They're out in a van driving around the city talking to heroin addicts. And we know many of them, and we're trying to get them into treatment. But before we can get them into treatment, we don't want to miss an opportunity to save their lives. So their loved ones should be trained. They should be trained. Treatment providers, we're trying to get all of the treatment providers locally to be trained. And as I said, the police, law enforcement, first responders, hospitals, they all have it. So it's really a tool that can be administered anywhere. Right now, it's the latest iteration is a nasal application. There used to be an injection that people were a little squeamish about.
Sure.
But if you come to the training, you'll get trained in it, and you get a little kit, which you can have. And there's 2 doses in it. Sometimes people need a second dose. To bring them back. It's pretty rapid. There's a good faith administration of this drug. You're free from liability. And if you're not in an overdose situation, and it doesn't do any harm to anyone, it just won't revive you. So if someone's having
Sure.
cardiac arrest and you think it's a drug overdose, you give them Narcan, nothing's going to happen.
Nothing's going to happen. 2 questions about expiration. Is there an expiration for the Narcan? That's whatever.
Yeah.
There's probably an expiration date.
Yeah, there is, and you just have to attend to it in the package.
Okay, and is there an expiration for the training? I know CPR training every so often, it will last for so long, and you need to be retrained.
Yeah, that's a good question. I'm pretty sure that we're trying to get the first level of training to as many people as we can, and I don't know that we're at the point yet where we're even talking about recertifying.
Okay.
So I'm not really sure.
Is the training free?
It is absolutely free.
Okay.
Come, bring your friends, bring your family.
And all anyone has to do, first off, to get in for more information, 447-4555,
Let me give you one more number.
Certainly.
2 numbers. So the 4555 number is our mental health general number, and that's, you want our services, you want a referral, you're in distress, call us. That's one number. I'm going to give you the mobile crisis number.
Yep, go ahead.
549-6500. That's when you or a loved one is in a psychiatric crisis. Mm-hmm. And for the addiction piece, we have an addiction unit in our department, and we have someone who is devoted to fielding calls around this issue, and that number is 447-4663.
Perfect. Lots of phone numbers, and I'm sure that that folks watching this program will benefit from that. They certainly can always go to albanycounty.com.
All on the county webpage, and you go to the mental health, and all of this is right there.
We're running out of time. We've got about 30 seconds. Community Services Board.
Yeah.
In a nutshell, if you're a member of the community and you want to be able to help out in some way.
Yeah. Well, so the Community Services Board is actually by statute in the mental hygiene law. Every county has to have one. We have a Community Services Board with subcommittees in mental health, addiction, developmental disability. They're volunteers. They're people in the community who have a strong interest, and we welcome volunteers to join. And if anyone wanted to call that main number, and they would route it to me, and I could talk to them about that. But
okay, folks can go to the website to find out about the Community Services Board, and then call the main number at 447-4555.
Correct.
Any parting thoughts? There's so much to talk about with mental health.
Yeah, for me, it is really slow down, try to be in the moment, be honest with yourself and those you love, and if you're not feeling happy, then don't make believe you're feeling happy. Talk to someone.
Thank you. Great advice. Well, I'm happy, and I'm going to smile. I'm happy you were here today.
Thank you so much. I'm happy as well, and it's a great opportunity.
Great. Thank you. Dr. Stephen Giordano, the Director of the Albany County Department of Mental Health. I'm Mary Rozak. This has been Albany County News. I hope you will join us again very soon.